You are welcome to my channel. Thanks for visiting. Remembering to subscribe, sharing all my presentations, and listening to this very one. Right now, I'll be addressing typhoid diagnosis. Don't be scared. You can see my screen. You can see snow falling. Don't worry, we're right now in summer, but we don't get there. This presentation will be brief because it will be centered on how to make diagnosis of typhoid fever alone. But if you want full info on typhoid that will cover the epidemiology, causative agents, the diagnosis, signs and symptoms, treatment, and vaccination, you can click on this very link. Okay, when it comes to making definitive diagnosis of typhoid, we can do a lot of things to get there. But it depends on where you are and the resources at your disposal. So if you are in the endemic zone of the world with typhoid fever, or you are in the Western world, but the patient before you has just returned or emigrated from the endemic zone, then high index of suspicion will help. It's either you don't have the equipment or technical know-how to do the appropriate investigations, and then you are going to base your diagnosis on high index of suspicion. Don't worry in a bit. I will handle that separately. And also, that's a tool you can use and save the life, okay? Then you can go to the clinical features that will be pointing to typhoid fever or enteric fever. Then you can get full details as per that and many more when you click on this very link. You can make use of laboratory for what? What are you going to go to do there? We'll know in a bit. Then there are certain radiological investigations that could be done. We'll go through all this in a bit. High index of suspicion. Someone will ask, how can you make the diagnosis of typhoid fever just with high index of suspicion? Okay, let's go through it together. Enteric fever should be suspected because it can be suspected in anyone that is coming from or living in the endemic zones for typhoid. If the history in such an individual is that there's abdominal pain that is associated with diarrhea or constipation and also with fever, that alone, the history of presenting illness, will be enough to raise the concern about typhoid fever. And as a matter of fact, when we go deeper, in some parts of the world where we cannot do so much after certain diagnostic procedures, then this alone will suffice to start the treatment. Now, full diagnosis will include microscopy, culture, and sensitivity tests. You can have blood culture, stool culture, rank culture, rose spot culture, but bone marrow culture is the most sensitive. The best would be to have the capability of isolating Salmonella typhi or Paratyphoid from culture. But if that is not the case and there's protracted febrile illness without other explanation, that will be enough in regions without the resources or when cultures are negative. High index of suspicion will be enough. So we should have microscopic culture and sensitivity done before we embark on the use of empirical antibiotics. Wider test, meaning serological test. This would dictate the anti-Salmonella typhi antibodies, but it has limited usefulness. While that, past infections may lead to positive results, particularly in the endemic zones. It could be positive for O, that is surface polysaccharide antigens, and H, that is flagellar antigens. There is a recent rapid antibody-based diagnostic test. Carriers of typhoid with enzyme-linked immunosorbent assay for antibodies to the capsular polysaccharide V1 antigen is a possibility that could be done with ELISA, enzyme-linked immunosorbent assay. But that is not for diagnostic purpose in the acute phase for carriers, okay? Then polymerase chain reaction has limited sensitivity because of low concentration during bacteremia. So PCR will also be done, but you're seeing the limited sensitivity, right? Antibody tests to detect serum IgA against hemolysin E are promising. We can have complete blood count done, a liver function test, renal function, clotting, provide, and group and cross-match. And will you ask me why will you do grouping and cross-matching? You may run into perforation with intestinal bleeding, hypovolemic shock, and you might have the need to transfuse. Lumbar puncture for cerebrospinal fluid, for analysis, right? And pleocytosis. Ultrasound, CT, X-ray of the chest and abdomen. Now, we are looking for a lot of things here, including pneumonia, including perforation, air fluid level, when there's intestinal perforation, right? And ultrasound to see what is happening to the liver, to the kidney, to the pancreas, CT for the same purpose, to see internal structure. And you can even have CT of the head when the typhoid has affected the brain, giving meningitis or encephalitis, or there's confusion. You want to be sure what is happening in the brain. Okay, the lab features can be pointing to anemia. Now, when there's perforation and massive bleeding internally, either concealed or is getting out through the rectum, and there's anemia, there's hypovolemic shock, there's dehydration, and all the likes, right? Leukopenia will left shift in adults, while leukocytosis in children. Leukocytosis in third wave with intestinal perforation is very common in individuals with complicated form of typhoid fever. Still, on possible laboratory features, there may be abnormal liver function tests and even raised enzymes. With that, we may be dealing with salmonella hepatitis, and C-reactive protein may be raised, and the lumbar puncture with CSL may return with mild pleocytosis. That have come to the end of this short presentation as per the way to make the diagnosis of typhoid fever. But for further or full information on enteric fever generally, you can click on this very link. There you are going to find full info on typhoid and paratyphoid fever, generally known as enteric fever, that will cover the epidemiology, causative agents, vaccination, full ways to make diagnosis, signs and symptoms, otherwise known as clinical features, and how to treat, even with complications. Thanks for listening. Remember to share. Remember to subscribe to my channel. I appreciate it.